With use and aging, things tend to wear out. Our bodies are no different. That wear and tear on our joints, a disease known as osteoarthritis, is fairly common. It affects 1 in 8 men and 1 in 5 women in Canada over the age of 50. And unfortunately, it's very painful. Pain is the first sign that a patient will have OA, osteoarthritis. And by the time they feel pain, there may be irreparable bone damage, there may be irreparable cartilage damage. And we only have a few options. We deal with the pain, or in extreme cases, we get a joint replacement. Well, when OA is assessed in clinics, physicians typically look at the cartilage. And although that makes sense, because that's the first thing that we'll see changes in, when it comes to pain, cartilage doesn't have any nerve endings. Bone underneath is where the nerve endings are. So in my research, I'm looking at the bone in patients with extreme osteoarthritis to see how those bone changes are related to pain. So we have a group of patients that are in extreme osteoarthritis cases just going in for a total knee replacement. We had them undergo a computed tomography scan or a CT scan, which will give us 3-dimensional x-rays where we can use image processing to measure the amount of bone or bone density in their joints. And the regions that I'm looking at are immediately below the cartilage surface and deeper into the tibia, the shin bone. Now, some of the really cool results that we found is that these patients with extreme amounts of pain tend to have lower amounts of bone. Now, when it comes to the implications of how we deal with osteoarthritis, this is pretty important. It shows us that, yeah, bone is involved, it's worth looking at, and it could be a therapeutic or a pharmaceutical target when it comes to dealing with the pain. But this low bone density, this is a problem because these patients that have extreme pain that are getting replacements, they have less bone and less, essentially, cement where their replacements are able to join into the bone. And it could put them at risk for further complications like migration, implant loosening, and even revision surgery, and nobody wants that. So this research, in the long run, I'm hoping that it might open our eyes that, you know what, maybe we're waiting too long when these patients are in too much pain, and we should get OA, osteoarthritis patients, in for their replacements sooner. But also knowing that the bone is involved, it'll give us a few more things to look at when we're dealing with pain in patients that may have this disease in earlier stages. So, and although aging, it comes with its wear and tear and it's inevitable, and some parts may wear out, hopefully it doesn't have to hurt as much, especially in our knee joints.